everyone. Welcome to another recording, another snippet session on what pharmacists do. Today, I am so excited to have Dr. Samantha Antonio back on. Hi, Sam. How you doing?
Hi, I'm doing well. How are you today?
Good. So last time you were here, we talked about what pharmacists do at the California Society of Health Systems Pharmacists and what they do in advocating for the pharmacy profession. But today you're here to talk to us about something a little bit different. You're adding onto the so many things you already do in your life in pharmacy. You're taking a shift in providing a certain type of services for healthcare providers, for people in the healthcare profession. And last time we talked about it, I thought it was so interesting. I wanted to have you on to share it with us, because when we talk about what pharmacists do, it's not just what they do at work, right? It's what they do in their personal life. If they take on a new personal entrepreneurship kind of project, that's part of what pharmacists do. We are human beings, we are mothers, we have relationships, and we use our experiences in our professional and personal life. And many of our experiences that we have are personal to ourselves, which is what personal means. But you, in this case, are adapting your life circumstances, your experience with family and coworkers and friends to provide a certain type of service to others.
Yeah.
I really want you to tell us about this. I think you're calling it coaching. So tell us about what inspired it, what kind of services you're going to provide, what kind of relationships you're going to have with your clients. Are they clients? What are you going to call them? So
yeah, clients, I
all
guess.
yours. Go ahead and talk to us about that.
Thanks. So yeah, I am trying to venture out into this coaching type of service to address one simple thing that I feel that we may need as a healthcare worker, and for me as a working from home type of individual. Who can we talk to at the end of the day to kind of de-stress or to talk about things other than work? What I've learned a lot about working in a work at home environment with multiple people in the home, with different agendas, different schedules, is that you are stationary in one spot. And although it is great, although you get all your work done and no one bothers you, how do you find time to meet that happy hour requirement? Or, you're going now to hang out with friends at the park afterwards, because things are starting to get back to normal, but still a little bit different. And I'm sure a lot of people are still working from home.
Yeah.
And on the flip side, I wanted to be someone such as like a friend that you can chat with if you are a pharmacist that works a 12-hour, 10-hour shift at the hospital, or you're a nurse in the ED, or even you are a physician and you're just, turning the day over. You're going in, you're completing your day, you're filling out your patient charting and whatnot. And then you realize, I need to wind down. I'm a human, aside from making sure you eat food, that you shower, that you bathe yourself and whatnot. You want to cater to that part of yourself that everyone's trying to work so hard on, right? Our emotional, mental health.
Yeah.
So for me, because I am speaking from very personal experience, going through my own personal journey, I find myself coming up with a lot of great ideas that maybe not always work for me, but may work for someone else. So just being able to give friendly advice to those who want to speak to maybe not so much a therapist or a counselor, but just someone who understands the workflow of working in a hospital or the workflow of working from home. And how do you, delineate the lines of, this is my personal life, and then, okay, I'm in work mode, because it's not as easy as you think.
It's not. And I totally agree. When I come home, I have my mom at home with me, and I have my 13-year-old and my 11-year-old. And I've had situations at work where I was upset about something, or something really stressed me out. Like let's say we use IV rooms or compounding isolators to compound, and one day both of them broke down and I couldn't do any compound, and the day was so, the routine was just broken, and the rest of the day was just stressful. And when I get home, and my son asked me, how was your day, mom? I just have to say my day was fine, because I don't know how to explain to him what a compounding isolator is, or what an ISO 7 or 8 room is, and how the requirements weren't met, because they're not going to understand it. If you're married and your husband is a lawyer and he doesn't understand that lingo, you're more inclined to just shrug things off and say your day was fine, because if you talk about it, they're not going to understand it, right? So if you have someone that you can really talk about it without feeling like you're stressing them out, I think it's a good outlet to turn to and discuss certain aspects of your day that are, in the non-work environment. So am I understanding that correctly? Is that kind of
perfect? And I love the example, because as you're saying it, I can feel the frustration within myself, like, oh my gosh, the compounding isolator, because I had to study it as well. So it becomes that I feel you, I get you, I see you kind of friendship or consulting, coaching service that I can help. I mean, it's so brand new. I figured,
it is.
Why not?
Yeah.
Because it is important, the work that you do. But yes, when you speak to a child or your parents or your spouse at home, it may not translate the same way. Our language in healthcare is so sterile. It's so specific and it's so different. So you can't really break it down into simple terms to say, oh, our machine wasn't working today, so it threw off my whole schedule because, and then you start making up stuff like, oh, solution A wasn't there. And but then you really just want to talk about exactly what you did.
Exactly.
Right? And it may fall on deaf ears.
I've totally been there. So how do you set it up? How are people going to reach you, and how are you going to have your conversations on the phone like this, on a Zoom Zoom meeting, and how often? Like, what is the plan? I'm sure you don't have anything completely set in stone yet, but what are you thinking?
Correct. What I'm thinking is exactly what you're saying. I have a website already up. It's I can give you the website URL later, but it's www.chamitonio.com. I use my same Instagram handle. I figured that's the best way to kind of attach myself to it. And there are two types of services that are on that website. But of course, because things are kind of in the process, I'm open to working with each individual the best way that they can. If they can only meet certain times in the evening, a lot of the times CSHP meetings are held 6 p.m. at night, 8 p.m. at night. I understand those are the times that pharmacists and other healthcare workers get free time after they're done feeding their kids, taking care of household items, etc. So that would be my target, trying to go for nightly conversations in a way that can help de-stress our healthcare workers so that they can do the job that we really need in the hospital. I learned on my last API rotation with what happened to be with CSHP is that EQ, what is it called? Emotional intelligence can be very vital and very important in the pharmacy world. So that's those soft skills. We are sort of trained in it in pharmacy school. You kind of learn how to apply it throughout rotations. But once you're thrown into the workforce, you're going into a team where, there's pharmacists that have already been working there for how many years already. They already have formed friendships. And so you're trying to learn how to be a new practitioner, plus learn how to play nice with all the other players on your team, and then learn all the rules of, what's that proper etiquette? How do I ask a proper question of my boss? Like, are other people receptive to wanting to be friendly with one another? There's a lot of things that go on in your mind that you don't think about. But we can't think about those things because we're focused on our patient. We have a lot of clinical values we need to attend to. We have to make TPNs. You have to do a lot of very clinical stuff. So I learned that shutting off all of the EQ, all of those soft skills was probably not the best idea, because now I'm having to revisit and kind of cure myself in how to communicate again and how to be a normal socialized human being again. Because once we're all done with school, whether it's pharmacy school, medical school, PA, we were in such a small group, small family, then we all dispersed and we all went on our different ways. So how do you survive from having a strong wolf pack to now graduating and now you're the lone wolf at your new institution? I want to be that friend, that fellow lone wolf that can help carry you along the way, because I'm going through the same thing.
Oh, wow. That is such a unique approach to, I just never thought about. It's like people that don't want to go see maybe a marriage counselor, because that idea is kind of, why do I need, I could just talk with my partner. But there's definitely an approach that the marriage counselor, for example, would have to help with your situation, and talking to someone who knows what's happening in your profession, in your workplace, and being able to kind of just have a therapy session, so to speak, in that way, and recharge for your next week or your next month or your next quarter. I think it's a very great idea, and I can't wait to hear more about how it goes. I might be one of your first clients. Who knows?
Let's do it. Yeah, I'm more than happy to work with clients. I mean, I enjoy making new friends and speaking to other people, especially phone conversations. A lot of the times everything's through text message or emails. We don't have face-to-face interactions anymore. So I want to try to bring that back.
Got it.
Especially into our field.
So how do people get in touch with you again, besides the website? We cite chammytonio.com, and Chammytonio, it's ChammyTonio.com.
Yeah. You can also reach me on Instagram
page, you said.
And then on the website, I do have my email listed, my email address. So if people want to just email to get an inquiry, it's already set up in a way where it gives you the direct link to email me, and then you just type whatever you'd like in the body. But like you said, this is a very new, unique experience for me and for you, whoever are interested in participating, and just trying to see how we can bring back a little bit of goodness into our world, a little bit of kindness. And if it gets to the point where you just need to talk to someone, it may cost a little money. I mean, I'm more than willing to work with people and try to meet them where we can, because by the end of the day, I think about it, we are the future of taking care of our parents, our grandparents. And if we are already burnt out from the gate out, imagine how we will be in 10, 20 years. So we really have to take care of everything that comes with mental health, emotional health. Now. And for me, I'm stubborn. I don't want to do it. I don't want to take care of it. So I figured maybe if you call it in a way where it's counseling specific for healthcare professionals, it sounds a little bit more not as, I don't want to do this, I don't want to talk to my girlfriends or my guy friends about my job today because I'm the only healthcare person.
That's an amazing idea, Sam. I really like it.
Thanks.
I can't wait to see how it goes. Before we finish up, do you have any news from CSHP? What's going on in your pharmacy world?
There's a lot going on with CSHP. For me, I'm finding my role as a staff member starting to step up a little bit more. Right now, we have 2 APPE students. One's from Western University and the other one's from Touro University. And I've been working with these girls for about 3 weeks now. And it's nice, interesting, and fun to be a co-preceptor. And seeing the excitement in these students' eyes and the willingness that they want to work with you. And I forget that because among the staff members, we just call each other by first name. So Dr. Lori Ann DiMartini, the CEO and the president of CSHP, we call her Lori. You know, we talk to everyone else by first name. And the students, they're so precious. They email me, they say, "Hello, Dr. Antonio, here are the meeting minutes from today's meeting. I hope, you know, if there's anything else we can do, let us know." And I'm sitting there and I'm going, okay, there is hope in the world. This is why I went through all the stress of the 4 years of pharmacy school, the master's program, you know, my biochemistry degree, so that we can help kids that, you know, are still very excited about becoming a pharmacist. And that fuels me in a way to say, yes, I like being a teacher. I like giving back. And if I can do that for my colleagues in a little bit more of a formal way through coaching or consulting, I'll give it a shot. I mean, who else is doing it?
Yeah.
Right? Let's be the first. I might not be known as the person that does it, but just like our vice president, I could be the first person to do it.
Yeah.
First female.
Yeah. That is an amazing idea. I just can't wait to see how it evolves and unfolds.
Thank you. I'm excited too. You have kind of injected a lot of re-inspiration into me for wanting to do this. And this is exactly why I decided to sign up myself for doing this project. I guess you call it a passion project.
Yeah.
Something that can give back to the community. I mean, we've done volunteering, we've done health fairs. How many vaccinations have we done already? But how can we give back to our own people?
Yeah.
And we need it. We need it. We're not saying we need it, but
and especially there's a lot of talk about pharmacists being burnt out with the pandemic. And I don't think your idea could be any more timely. Because there's a lot of burnout going on. And I hope
that shouldn't be a word that is associated with our job. It should not.
Yeah. So thanks for trying to be part of the solution. And I'm looking forward to having you back on to talk about how it's going and how it's evolving. Thank you so much for coming on, Sam.
Thank you. It's always a pleasure talking to you. I have fun.
We always talking to each other outside of this. So we always
I always tell my colleagues, I even tell my parents that you were the one that interviewed me for pharmacy school. So if it weren't for you, I wouldn't be here now. So thank you, Dr. Wabo, for all that you've done.
You better thank
me. You granted me access into pharmacy school. So thank you.
You better remember that. Yeah,
I do every day.
I had completely forgotten about
grateful.
that. I completely forgot about it. I think it was you and Ashley, and I remember
there was
that
only a handful of us.
Yeah. Anyway, we'll be in touch. Love you.
Thank you.
And guys, reach out to Sam if you're interested. All right.
ChammyTonio.com. Bye.
Yeah. Same on Instagram, Chammy Tonio. Bye, everyone. God bless.